Thank you all for joining today's webinar on managing stress and coping during COVID-19. This webinar is offered to you in part by the USF 21D Consultation Program, the USF OSHA Training Institute Education Center, the Sunshine ERC, and the University of Central Florida. This presentation is not a standard or regulation, and it creates no new legal obligations. It contains recommendations as well as descriptions of mandatory safety and health standards. The recommendations are advisory in nature, informational in content, and are intended to assist employers in providing a safe and healthful workplace. The Occupational Safety and Health Act requires employers to comply with safety and health standards and regulations promulgated by OSHA or by a state with an OSHA-approved state plan. In addition, the Act's General Duty Clause, Section 5A1, requires employers to provide their employees with a workplace free from recognized hazards likely to cause death or serious physical harm. The webinar will be 1.5 hours in length. We will reserve approximately 15 minutes at the end of the webinar to answer questions. You may experience some delays during the presentation as we transition between speakers. A few ground rules before we begin. You've been entered in listen-only mode. Please enter your questions as they arise into the questions box. All questions will be answered at the end of the presentation. If you should experience any technical difficulties during the presentation, please contact your department's IT help desk. A copy of today's PowerPoint will be sent to the email address you entered at the time of registration within 5 business days. And finally, a survey will be distributed towards the end of the webinar. It'll take 2 minutes to complete. Your feedback is very important to us, as this allows us to continue to offer quality webinars that are beneficial to you. My name is Nicholas Giroux. I'm the Marketing and Communication Specialist for the USF SafetyFlorida Consultation Program, and I'll serve as your moderator this morning. Today's panel of experts consists of Dr. Brian Ward. Dr. Ward is the Program Director of the USF SafetyFlorida Consultation Program at the College of Public Health. In his role, Dr. Ward's efforts focus on aiding Florida's employers in developing effective health and safety programs to improve employee workplace health and safety conditions. Dr. Ward brings more than 30 years of leadership experience in environmental, occupational health and safety, including 28 years as a U.S. Air Force officer. Next is Dr. Deborah Beidel. Dr. Beidel is Trustee Chair and Pegasus Professor of Psychology and Medical Education and Executive Director of USF Restores of the University of Central Florida. Dr. Beidel is a fellow of the American Board of Professional Psychology and holds a diploma in clinical psychology and behavioral psychology. Along with her UCF Restores faculty colleagues, Dr. Beidel leads bench-to-bedside clinical and research initiatives that impact the lives of veterans, active duty military personnel, first responders, survivors of sexual assault, and survivors of mass shooting. Without further ado, I'll now turn the webinar over to Dr. Brian Ward, the USF SafetyFlorida Consultation Program Director.
Thank you, Nick, and a good morning to everyone. You know, over the past 12 months, the USF SafetyFlorida Consultation Program, the OSHA Training Institute, and the Sunshine ERC have been focused on providing training on topics that have plagued the industry for some time. You know, we've conducted webinars addressing physical hazards such as heat, illness, and electrical safety. We've addressed chemical hazards as the case in confined spaces. We've conducted webinars on ergonomic hazards and, more importantly, biological hazards as it relates to conducting risk assessment in this current pandemic. These are hazards that we are quite familiar with as safety and health professionals. What we have not addressed, and I'm most excited about, is the discussion or the aspect of psychological stress brought about by this pandemic. You know, recent studies have shown that this psychological stress has affected not only healthcare workers, especially those in the front line, but also migrant workers and workers in contact with the public. To be honest, this is outside our wheelhouse. So I'm overly ecstatic to learn from Dr. Beidel about how employers and employees can identify risk factors of stress, recognize what it looks like, what it feels like, and finding ways for us to cope with it. The goal is ready to assist employers in managing workplace stress and build their resiliency as they navigate through the idea of returning to some sort of normalcy. Before we begin, though, I'd like to take a minute or two to showcase or discuss our sponsor, which is the USF SafetyFlorida Consultation Program. The USF SafetyFlorida Consultation Program is the state's official program administrator for safety and health. Not to be confused with OSHA enforcement, where citations are issued or penalties proposed. The consultation program primary mission is to assist Florida's small businesses comply with OSHA standards, thereby eliminating workplace hazards that can potentially cause injury, illness, or even death. Essentially, we help employers maintain a safe working environment. Our services are free and confidential. And while working with us on the consultation side, you can actually defer a planned OSHA inspection. We help keep employers profitable by minimizing cost or avoiding costs related to the direct and indirect cost of injuries and illnesses. We also help employers reduce their workers' compensation costs because of these reduced illness and injury claims. We also help, in a more direct fashion, help employers avoid these OSHA fines and penalties, which could range in upwards of $13,000 per incident. And lastly, we help employers remain profitable by increasing their productivity. We have over 150 years of combined occupational health and safety leadership experience. Nothing on psychological, unfortunately. We've got experience in construction, maritime, manufacturing, and agricultural operations. And we are positioned in each region of the state so we can provide one-on-one consultation with our clients. Our focus is on small employers with high hazard operations to help not only identify hazards, but also work with the client in providing what I call viable, feasible solutions. As we look to building sustainable systems, our team is focused on helping employers develop customized health and safety management systems in preparation of developing a program that is sustainable for the lifetime of the company. These systems are continuously being reviewed, revamped, and renewed following this quality methodology. Our online tool, known as a Safety Writer, is second to none. It provides employers the ability to produce their own site-specific health and safety plan based on their own industry or a specific hazard within that workplace. The plan is also stored online for easy retrieval and update, or can be filed as a paper document. We also offer free DVD, but more importantly, an online streaming video system that provides a number of safety and health topics to include the current COVID crisis. And this training is provided not only in English and Spanish, but we do have some in Creole to meet demands of that population. I urge you to visit us online at safetyflorida.com as we endeavor to make Florida the safest place to work. To add to the sponsor, we've got the OSHA Training Institute Education Center. This is the OTI that serves the southeast of Florida, and they provide trainer courses in a variety of general topics in maritime, construction, disaster site worker training, and in the general industry. And lastly, they offer some technical courses as well, ranging from respiratory protection all the way to scaffolding. These are highly technical courses that range in upwards to of 3 to 5 days in length. That can be done virtually, or it could be conducted at the employer's workplace, and most of the time it can happen at the Wesley Chapel office where they're stationed. I urge you to visit them online at usfotiec.org to get the latest listing of the training provided. So without further ado, I now turn the presentation over to Dr. Bidell. Again, I am really excited to hear and learn what employers can and should be doing to minimize the issues we have with psychological stress. So Dr. Bidell?
Yes, good morning, everyone. It's great to be here. And of course, the city has just decided to trim the tree right outside of my house. So hopefully it will only be a couple of minutes, and then you won't hear that annoying sound in the background if you're hearing it right now. I wanted to speak for a few minutes about UCF Restores in case people don't know about us. We are a clinical research center at the University of Central Florida. We do research that does go from basic studies of educating people about trauma to the prevention of trauma, and then on to the treatment of trauma. We have a clinic that currently is free to residents of Florida who are experiencing the effects of post-traumatic stress disorder or trauma. It is limited to the groups that we discussed earlier: veterans, active duty personnel, first responders, emergency workers, survivors of mass shootings, and survivors of sexual assault. But that is the focus of our work. And since the time of COVID-19, we've been thinking about how do we manage stress and how do we cope during what I've continued to refer to as a globally traumatic event that as I said, 2020 was the year of an election of our lifetime, which we are not going to talk about anymore today, but certainly a stressful event that was going on at the same time as a global pandemic. And so we then go to looking at sort of what COVID was doing to us. When we look at the rise in the fall and the number of cases that we had, and the number of hospitalizations, again, thinking about all of this is certainly a serious stressor that we were facing. We also then, last year at this time, faced, everybody had to go home. So New York City never looked so empty. The rest of our world never looked so empty, with people not going out of their houses. We also faced all kinds of shortages, including the famous can't find toilet paper shortage. But the idea that somehow things that were always available and we took for granted were no longer right there, whether it was for some people food, for other people toilet paper, for other people just social interaction. And finally, what hit most were these jobless claims. The number of people who suddenly lost their jobs because of having to go back in their house, because of businesses being closed, and the fact that even since that time, we really have not recovered. Certainly not as many people are unemployed as it were at the height of this, but we still have a number of people who have not yet been able to find a job or more employment. So in addition to these very big major events that happened during that time, we also want to think about the stressors and the daily hassles that really have been affecting us, because in some ways, these can really combine to create more unstableness, more trauma in our lives than any one of those major events. They trickle down from it, of course. And we're talking about things like working from home and changes in schedule. One of the companies with whom I consult does a lot of work with people who monitor the internet. When those people all around the world suddenly couldn't go to the office to do their work, there were problems in the fact that many of these people living in other countries did not have a home office, did not have the computer support or the network support to do the job that they were assigned to do. So not only just changing our schedule, but the idea of whether or not we had the tools to work from home. The second was balancing personal and family issues while working. Anyone who has children and was trying to homeschool your child at the same time you're trying to do their job certainly faces this challenge. And for those people, some are lucky enough to have multiple computers, but for many people, there was one family computer. And that case really creates difficulty when you're trying to do a Zoom call and your child's trying to get online with their teachers to do their math homework. The social isolation is something that I think we faced, and as I've told people before, thank goodness for the internet, because our social isolation would have been a lot worse if we didn't have Zoom, GoToMeeting, Microsoft Teams, all those other things, Facebook, all those other things that we managed to use to stay connected during this time when we physically could not connect. Lack of access to the tools and equipment to perform the job. Well, we spoke about that a little bit above. Things are intertwined, but the fact that many people didn't have webcams at home, and then suddenly you couldn't find a webcam anyplace to do your work. And the inability to participate in recreational activities. What we know about exercise and recreational activities is that they release endorphins into our brain. Endorphins are our body's natural mood elevators. So it works like Prozac. And without the ability to do some of those exercises, go to the gym, participate in team sports, people found that they weren't able to get out, they weren't able to get rid of some of the stress they had or get any improvement from what they're trying, the stressors that they were trying to face and the isolation that people really were feeling. The one thing we do know is that after this period of time that we've been there, we saw emotional distress starting to rise. And I'm talking about not necessarily a psychological disorder, but changes in our emotional state. So people feeling much more stressed and irritable, people feeling sad and depressed, people starting to feel that they couldn't go to sleep, having insomnia. The one thing to remember, and we're going to come back to this a little bit later, is that sleep and sleep disruption is our body's first signal that something is wrong. So when we consistently can't sleep, that's our signal that we need to do something. Excuse me. We also saw changes in the emotion of anxiety, fear, confusion, anger and irritability is a big one. We've all been facing that, either as being the person who's been irritable or being the person on the reception side of someone else's irritability, frustration. And there were some very real causes for this. First was housing or the inability to pay rent. If we look at the number of people, this graph on the right, of what happened to people during that time of the pandemic, when people suddenly lost their jobs, you can see that for everyone, these are the social determinants that created a lot of these symptoms. We had housing instability. We had people worried that there's not enough food or not having enough food. The amount of hunger and the people who are food insufficient in the country right now went up and is still up. Getting needed healthcare services. What we don't often think about is that still, for so many of us, our health insurance is tied to our jobs. When you lose your job, you lose your health insurance, and then you start to worry about how you're going to get health services and healthcare that you need. And then finally, of course, the big one was the loss of job and income. But all of these social determinants that then functioned to increase our emotional distress. I can't find a more recent graph right now, but in looking at what happened during late June, 40% of adults, according to the CDC, reported struggling with mental health or substance abuse issues directly as a result of the global pandemic. These are not the people who have it anyway. This is the number of people who started to have difficulties as a result of this global pandemic. If you look at anxiety and depression symptoms on the left side of that graph, 31%. That's double the number of people in the general population that typically have anxiety or depression symptoms at any one time. So we've doubled the prevalence. Similarly, with trauma and stressor-related symptoms, we have doubled the prevalence since COVID-19. What is really even more concerning are those graphs on the right, those bars on the right, where we talk about started or increased substance use. 13% of the population say they have started or increased their substance use as a result of stressors from the global pandemic, and 11% seriously considering suicide. Again, that rate is double. And I can tell you from what we've been talking about as clinical psychologists, this rate has continued or even perhaps increased since last June. So as I said, when we talk about mental health complaints or disorders, 70% of the population is reporting fears and worries, 60% worries and 70% fears. Alcohol use, 88% of people in this sample were saying they're using alcohol to cope with how they feel during this pandemic. That doesn't mean they're all drinking to the point of becoming addicted. But people are saying, I find I'm drinking more wine. I find that I'm having a drink every day where that wasn't the way I usually did things. 55% are reporting an increase in use over the last month. And 18% in this sample, 13% in the other sample, 18% in this sample, are reporting a significant increase in their alcohol use. By far, the most common psychological disorder we're seeing is post-traumatic stress disorder, but it's followed closely by anxiety and depression. And I think this is important for people who are employers to remember, is that the response to trauma can be quite varied. Not everyone is going to get a diagnosis or has a diagnosis of post-traumatic stress disorder. Trauma can lead to other things such as general anxiety, depression, grief if someone has passed, substance use. So it's going to be a variety of mental health problems, although the most common one will probably be post-traumatic stress disorder. So I thought we'd do a couple poll questions to give you an opportunity to think about some of these things. So our first poll question is, which of the following age groups do you think is experiencing the most emotional distress from the COVID-19 pandemic? And 18 to 24, 25 to 44, 45 to 64, and 65 plus. You can put your answer in now, please. Well, people are saying that 25 to 44 is the most common, followed by some of the other younger groups, and then last, at least 65 plus. This is a very smart group because I'll tell you, most people think that it's the 65 plus. So you all are on the ball. When we look from this study published last year of emotional distress, who was endorsing the most negative or mental health problems, we can see it really is the younger groups. And the 65 plus group really, although we talk about people who are in nursing homes and grandparents who can't hug their children, in a general sense, you all were very good on this one, that it really is the younger groups, and primarily in this one, the 18 to 24-year-olds. Newer data suggests that adolescents are having as much difficulty as are younger adults. So, you know, why might these be some of the reasons? Well, some of the reasons might really be because there's more financial instability in these younger groups. If you think about what we talked about earlier, that the biggest concern during this pandemic was losing one's job and other things that trickled down from that, you can think about these younger groups as not only probably being more likely to have lost their job because of their age and lack of seniority, probably because they also have jobs that don't easily translate to working from home. But they also certainly make less money. When we look at the job losses owing to the COVID-19 pandemic, by the survey date, you can see that the biggest loss in terms of percentage of workers losing their job fell in that group that made from $20,000 to $39,000. And so we see it falls off dramatically as we get to people who have higher incomes. And of course, then what we see again is when you lose your job, you lose your health insurance. And so you're now facing not only a financial crisis, but perhaps a health crisis as well. And all these factors are combining to create these high levels of stress and mental health. So I've been using the word stress, but let's talk for a minute about how stress works so that you'll understand where we are right now in terms of this stressful event we call COVID-19. We look at something that we call the general adaptation syndrome. And basically what we have is our first response when a stressful event occurs is what we call an alarm response. You might also call it fight or flight. If you had intro psych, you may remember that term from the psychology class. And this is the activation of our body to either fight the threat that's in front of us or run away from the threat that's in front of us. So our body produces adrenaline that allows our muscles to work harder, that allows us to run faster, that allows us to, move mountains where we might not move mountains before. We have this sort of almost like the Incredible Hulk response when we're in the alarm phase. We can do things because our body is energized. We then go to this resistance phase as the threat does not go away, and that we find we're coping with the stress. We're trying to find ways to deal with it. We're trying to adapt to it. And our body, unfortunately, can't keep this up forever. That we can't keep pumping our heart at 140 beats per minute. After a while, it's going to slow down, because we just can't do that. And we start to deplete the resources that we have. So all of those hormones in our body that keep our body functioning properly and appropriately start to get worn down, start to get worn away. We don't have them anymore, and we can't make them at the level we need to make them to continue to fight this general stressor. And we get to the third stage, which we call exhaustion. And I think that's where a lot of us may be right now or feeling that way. Our resources have just been depleted. We find that we really can't maintain the same schedule that we did before. At first I thought, this is great. I'm going to not have that 45-minute commute to my office every day and commute home. Great. I'm going to have an extra hour and a half I can work every day. And now I find I can't do that anymore. That 45-minute break was really important for me to recharge and get a little bit of energy back before facing the tasks I had to do either at work or at home. Without that, what we're finding is that people just don't reset in a way that's very important for them. Our capacity to continue to function is exhausted, and in some cases, we're really doing damage to our bodies. What we know about, for example, people who have chronic stress from post-traumatic stress disorder, from studies of children who have had years of physical or sexual abuse, is that the part of their brain called the hippocampus, which is the structure that helps us make and retain memories, that structure actually starts to get smaller as a result of the chronic stress and the chronic trauma. So we're actually having changes in our brain as a result of continued stress, continued traumatic events. And what all that means is that functionally we deteriorate. We can't do our job as well. We can't parent our children as well. We can't do any of the things that we were doing so efficiently before. We now don't have the opportunity to do that. The good news, though, about the hippocampus and the other functions is that we can reverse the damage that's done. You can, when you take someone out of an abusive situation and put them in a supportive situation, their hippocampus will start to regenerate. So it doesn't have to be a permanent loss, but it certainly is an important and significant concern, something that we have to talk about and think about as we continue to work our way through this stressor. We get to the point where, you know, we can't stuff it anymore. In my work with first responders, they tell me that they're always told, suck it up, buttercup. You knew what the job was. But it gets to the point, like the overloaded trash can, where there's just no room to shove it down anymore. Can't keep doing that. And that's when we start to see not only changes in people's emotional state, but changes in their behavior. So what can we expect for this coming year? I don't know about you, but my crystal ball is really cloudy. I don't know exactly what's going to happen over the next year. But I do know that we're going to have these continued stressors. We know that the COVID-19 virus is changing its format, is getting different variants. We hear that the new variants may be stickier than the old variants, more likely to bond, more likely to stay bonded. So even when we think we might have defeated this virus, it doesn't seem to be the case in general. We're exhausted, right? We're tired of wearing masks. We're tired of fighting about whether or not to wear masks. I'm not going to get into that, but we're tired. We've been doing this for a year. We thought we were going to do it for a few months. It's a year. Some people are saying unless the whole world gets vaccinated, we're going to be doing this until 2023. So we're going to have this continued stressor. We're going to need to somehow manage it. And, you know, we've got the vaccine now. We've got several vaccines now. For those of you who've been lucky enough to get the vaccine so far, you know, you're feeling a little bit better. You're feeling like at least now you have some ability to repel the virus and hopefully a number of the variants, and that you'll be able to do some of the things that you have not been able to do. And then we hear, oh, but you can't do this. Oh, but you still shouldn't go on the planes. So again, the virus is a wonderful thing. For everyone I know who said they've got a virus, the next question they're always asked is, which one did you get? So it's become part of our lives, and hopefully it will allow us to get back to some sense of normalcy. So what is our new normal? You know what? I don't know, but I have some things what I want all of us to think about is what is it we can do that's in the moment? What can we do to help ourselves get through this period of time? And what can we do to help those who work for us and with us to get through these periods of time? Some people are lucky enough to work in a place where they can either go to the ocean and do some yoga, or have a yoga or a exercise room within their company. Most of us don't have those opportunities, but there are some things that we can do. It's a really good app out there called Calm. Some people may be using it. For a while, they were giving it away free. There is a free period now, and then it's a subscription. I think the last time I saw it was $69 a year. For anybody who can afford it, you know, it's the best thing I've seen to help you in the moment. It has things like deep breathing. It has things like calming sounds. It has things like sleep stories to help you sleep. We're going to talk about sleep in a few minutes. But using an app like this, or this particular app, can be really helpful for dealing with those in the moment stressors that might come upon you. Just practicing taking some deep breathing. Let me tell you how to do deep breathing, and you know, you can follow along at your desk. When we're talking about doing deep breathing, we're talking about breathing at the diaphragmatic level, not from your chest. So what I want you to do is to put one hand on your chest, the other hand on your stomach. As you breathe in, what you want to do is make your stomach larger, right? Breathe in so that you feel your stomach expanding and your chest is staying about at the same level. So don't let your hand on your chest move. Let the hand that's on your stomach move. I'm going to count in to 5, and I want you to just breathe in and try and just breathe in diaphragmatically. Ready? 1, 2, 3, 4, 5. Exhale. 1, 2, 3, 4, 5. Inhale. 1, 2, 3, 4, 5. Exhale. 1, 2, 3, 4, 5. Just doing that simple procedure when you're starting to feel overly stressed or overly angry can help you have some calming release in the particular moment. Now, it's not going to change your job situation. It's not going to change the family stressors that you might have, but for those few moments, it will give you a chance to recenter and to breathe. Lavender. We know that lavender has some calming properties. What we're finding out now, though, is that, again, a little bit of lavender oil or a similar calming smell, a drop or two in the palms of your hands, and then taking a breath or two with the lavender has a biological effect, a calming effect on your brain, so that it will help you, again, in the moment, deal with some of those stressors that are overlaying on top of this global pandemic. Another one is taking a walk in nature. It's not just taking a walk. The data show that it has to be a walk in a green surrounding. So through a park, perhaps on a deserted road, perhaps even in a quiet neighborhood, if you live in a quiet neighborhood. But being in touch, walking in nature has been shown to do 3 things. It will decrease your emotional stress. It will decrease the level of adrenaline and other hormones in your body, and it will improve your cognitive functioning. And I'm talking about a 15 to 20-minute walk. Not talking about walking for 3 hours. Just a quick break of 15 to 20 minutes in a green environment will, again, work to decrease a lot of the momentary stress you might feel. One of the questions I know someone raised before the webinar was, what are some signs of stress that you might see in yourself or in your employees? And this is a great question, because when we as psychologists talk about and hang that word disorder on someone's condition, you know, you're not just generally anxious, you have generalized anxiety disorder. What does that mean? That means for us that you're not just having an altered emotional state, your emotion is now impacting your behavior. And that's the point at which we suggest to people that some treatment might be necessary. This is the point when you see some of these behaviors that you might need to pull an employee aside and talk to them about what they might do to decrease their anger, decrease their stress, whatever is the problem. The idea is you're focusing on the person's behavior, not on their emotional state. So you want to look for things like sudden changes in behavior. And these could be increased sick days that someone might have. So this is an employee who never called out sick. And then suddenly, you know, they're calling out a lot, particularly calling out on Fridays and Mondays. Poor work performance. You know, someone who was always one of your top performers, always got the job done. They're now missing deadlines. They're now having trouble doing things that typically before were not problematic. They're not doing certain job requirements or types of calls as we talk about it in the first responder world. So they don't want to go in first responder world, someone who's having difficulty after a traumatic event that maybe involved a child. Now, anytime there's a child call, they find someone else in the station to go. They don't want to do it. In whatever kind of work you have, you might find that people are avoiding certain job requirements. That they didn't avoid before. That's a signal that something is wrong. Decreased social interactions and also increased anger and irritability. You know, your employee that was always the party planner, the one that always organized the birthday events, organized the retirement events. Suddenly they're not talking to anybody. They're not doing those things. They've decreased their social interaction. They're not looking for people to go to lunch. Or they may be just having increased anger or irritability. You know, people are getting nasty emails now from this person where they never did before. You may see increased alcohol use, and you may also see DUI or other offenses. Less likely you will know about those, but it's important to say that this does not mean that a mental health disorder is present just because you see these events, but it does mean that something is really wrong. These kinds of changes in behavior are really important to observe and particularly to do something about when you see them in your employees or in yourself. So here's the second poll question. I said we're going to talk about sleep, and we are in a moment. So when I am having trouble sleeping for several nights, not just one night, but for several nights, you're having trouble sleeping, I turn on the TV to help me sleep, drink some alcohol to help me get to sleep, play on my phone, or take a nap the next day to catch up on sleep. So we'll give you all a minute to answer this question. There's the results. So, see, my screen's really little, but catching up on naps, playing on my phone, turning on the TV. Good. Not a lot of people are drinking alcohol to get to sleep. Good. Well, the bottom line is none of these are really good to do. So let's talk a little bit about sleep and why some of these are not really helpful. So there are different types of sleep problems that one might have. One is difficulty falling asleep or insomnia, and that's usually the first one that people notice. A second one is difficulty staying asleep. So you can fall asleep, okay, but you cannot stay asleep. Another one is having nightmares. And these are a lot of nightmares, particularly after perhaps an extremely traumatic event, having repeated nightmares about that particular event. Panic attacks in one's sleep. Suddenly just waking up with this overwhelming sense of anxiety, maybe waking up in a sweat, sitting up suddenly. Your heart is racing, you find you can't breathe. Panic attack is occurring. And then the last one is feeling exhausted even after you've been sleeping for a period of time. So you go to bed, you think you're sleeping, you wake up and you still feel exhausted even after 7 or 8 hours or 6 hours of sleep. So these are all our body's way of telling us that something is wrong. Our stress level is too high. Again, I'm not talking about just one night every couple of weeks or one night a month. I'm talking about a repeated number of nights where you're really having difficulty falling asleep. So what are some good sleep hygiene habits? If you're having this kind of problem, how is it that you can get better sleep? Well, the first thing is to maintain a regular sleep schedule. And this means that you are going to sleep and getting up same time each day. We all have a 24-hour clock called a diurnal clock. It's all a little bit different in some of us, right? We have the night owls, we have the early birds. People have different patterns of sleep based on our 24-hour clock. What you have to do is find your 24-hour clock and then make sure you're sleeping during that particular time, even on the weekends. If you're having sleep problems, this is the way to start to get over it. It's not, you know, sleeping longer on the weekends or doing other things. It's maintaining, if it's 10 o'clock to 10 p.m. to 6 a.m., that's what you do every single day. This will help regulate your sleep, and this will help you get back to sleeping regularly. A second consideration is if you're having a lot of difficulty sleeping, avoid naps. Now, if you've just had difficulty one night and you want to take a nap the next day, that's perfectly fine. But for people who are having significant emotional distress, which includes problems sleeping, taking a nap doesn't help. It just messes up your diurnal clock. It messes up your sleep schedule, and you have to stop it. So if you feel like you need to go to sleep during the middle of the day, you have to do something to kind of keep you awake during that period of time. So clean out a closet, get rid of some clothes that you don't want anymore, go outside and work in the garden, do something to keep yourself from sleeping so that when it really is time for you to go to sleep, you can go to sleep. The next strategy is something that I never do, but that is if you're laying in bed awake for more than 15 minutes, get out of bed. What happens if you don't is that your brain starts to associate not sleeping with being in bed. This means that you're conditioning your body to not sleep in the place where you should be sleeping. What you want to do is get out of bed and do something that will make you sleepy. Read a book, a real book, not an electronic book, and I'll talk about why in a minute. You want to do something else that could be relaxing. And then get back in bed when you start to feel sleepy and try to go back to sleep. And if you're still awake after 15 or 20 minutes, get up and do it again. You need to start to only associate your bed with sleep or sexual activity. Don't work in your bedroom. Don't work on your bed. Don't eat on the bed. Don't do all those other things that then our brain subconsciously associates with not sleeping. Keep your bedroom cool between 68 and 72 degrees, best temperatures for sleeping. You'll find you'll be easier to do that. Another tip is to don't watch TV or read on electronic devices or play on your phone when you're in bed. We all do it. The problem is that all of those devices emit a blue light. You can't see it, but it's there and it's coming right into your eyes and it's going to your brain. The blue light is our brain's signal that it's time to be awake, okay? A blue light is what we see in daytime. So when you're trying to go to sleep and you're blasting a blue light into your brain, it's telling your brain to wake up. So that's why you don't want to be using those devices when you're trying to sleep. Now, I did mention earlier that Calm has some great sleep stories on. Yes, they do. And the sleep stories are very calming, almost to the point of being boring. They're good to listen to, but turn your phone upside down so that you don't see the blue light coming out if you're using those stories to help you go to sleep. Don't use caffeinated beverages within 3 hours of going to sleep. This seems to be something that not a lot of people do anymore. They do watch caffeine, but again, within 3 hours of sleeping, you're going to find it's just going to keep you awake. You should exercise regularly, of course, but not within 3 hours of going to sleep. You don't want to be energizing yourself if you're having sleep problems and trying to go to sleep. Do some activities, but relaxing activities such as, taking a hot shower, reading a real book or a magazine, doing other things, listening to music, those things that can help you calm down and wind down. So why not alcohol? What's wrong with alcohol? Well, the problem with alcohol is that it's not a sleep aid, and too much alcohol causes you to pass out. It doesn't cause you to sleep. Passing out is different from sleeping. And the main problem is that alcohol will interrupt your circadian rhythm. So you may think you fell asleep quickly, but you're going to wake up in the middle of the night. You're not going to be rested. Alcohol, what it does is it blocks what we call REM sleep, rapid eye movement sleep. Rapid eye movement sleep is the sleep that we have when we're dreaming. It's our deepest state of sleep. So if you've got too much alcohol in your body never gets into that very deep, very restful sleep. You don't dream, and you're going to wake up groggy. For people who have had a significant traumatic event, such as a combat event or a mass shooting, what happens when they drink alcohol is that it blocks the ability of that event to become a memory. So how do I explain this? When we go to sleep and we're dreaming, that's the time when our body is consolidating everything that happened to us during the day and storing all of those experiences in our hippocampus, our memory center. If we're not dreaming, those things never get translated into memories. And for people who have experienced a traumatic event, they continue to then experience that traumatic event as if it's happening over and over again, what we call a flashback. But for the rest of us, even if we have not had that kind of traumatic event, not sleeping doesn't allow things to get processed in our brain. Think of it like putting the day's experiences into a filing cabinet. It doesn't happen. We wake up groggy. We have trouble concentrating the next day because we didn't sleep. We have trouble paying attention. Oh, guess what? Our brain is overloaded. We didn't file things where they needed to be, and we're having trouble processing new information. The last thing is alcohol means more trips to the bathroom, right? It's a diuretic, so you have to get up more often. So a lot of reasons not to use alcohol as a sleep aid. The next thing I want to talk about is anger, because I talked about anger and irritability. And so when we're talking about anger and irritability, want to figure out how do we stop? Yeah, that was me about 20 minutes ago, about an hour ago, yelling at the computer because I couldn't get something to work. But what we want to do when we're angry is to use just something like problem-solving skills. So very simply, to talk about what we call BRISK: break, reevaluate, identify, solve, and communicate. It's a good way. We actually do anger workshops for people to try and help them learn these types of skills, but to utilize some problem solving, stepping away temporarily to try and do some deep breathing, get a hold of yourself, start to think about the situation in a different way, figure out what the problem really is, because often what we think is the problem is not the real problem. Brainstorm lots of different solutions and then look at which ones might be most effective. So to think about what are some of the things that we might do in order to deal with our anger and deal with our anger more effectively. So taking a break, doing some deep breathing to calm down, and then starting to look at the situation and figure out how it is that we might be more effective in solving the problem. Something that you can do pretty easily if you just sort of look at the steps, and the slides will be provided to you afterwards, but an effective way to kind of deal again with those temporary anger situations. So how do we support our employees and our coworkers during these times of stress? And I think first we have to acknowledge that the stressors really exist, that as much as we think that we're functioning pretty well, we may not really be functioning as well as we think we should be, or we think we might be. And it's happening to all of us. As I said, this has been a new situation. Things have been really different for all of us. And we have to acknowledge that we're impacted by it. As I tell the first responders that we work with, they're heroes. They may be superheroes. They're not invincible because they have a heart. And so things are going to affect them. Even with all the trauma that they see every single day, they don't become immune to it. It just builds up. So we have to acknowledge that the stressors exist. The second thing is, as supervisors, we have to promote an atmosphere where people can talk to us. I tell every new employee who comes into work for me that the only mistake I cannot fix is the one they don't tell me about. That I know people are going to make mistakes, I want them to be able to tell me that they're going to make a mistake, so together we can fix it. If you promote that kind of an atmosphere where people think they can come talk to you about what's going wrong, then you're going to be able to be more supportive of them, and they're going to listen to you when you talk about stress and maybe some things that might need to be changed. The third is to encourage people to take their vacation time. What we're finding in this pandemic is that people are not taking their vacation time because they're working from home. So they don't feel they don't need a vacation because they're not at work. Encouraging people to take their vacation time obviously gives people a chance to recharge, gives them a chance to go walk in the woods. It gives them an opportunity to, slow down and connect in other ways. And so if you encourage people to take their time off, to take their vacation days, and reach out for help if they need it. Again, you might not, as their supervisor, need to know everything that they're experiencing. You might not need to know all the details. You might just need to know that they have a physical ailment and they're going to need some time off to take care of it. Allowing your employees to tell you at the level they feel comfortable, but enough so that you know what to do in their absence, but to give them an opportunity to be able to talk to you about what the difficulties they're having is going to be a long way toward promoting an atmosphere where people are going to feel that even as the stress continues, that they're at a place where they're supportive and they can take a break when they need to. I want to talk just a few more minutes as we wrap up about post-traumatic growth. And that is that, as I said before, not everyone responds to a stressor or a traumatic event in the same way. If you look at these 4 lines that are on here, the bottom line that I've labeled resilience, and this is work by George Bonanno at Columbia University, but these are people who, in the face of a traumatic event, when the event occurs, might have a mild reaction. So they might have trouble sleeping for a little while. They might have trouble eating, not eating well for a little while, but they're pretty resilient. And shortly after the event, they recover. They go back to what their normal state was. In this case, this was time since the death, the untimely death of a loved one, but it could be any type of traumatic event. But they're functioning pretty well, pretty soon after the event has occurred. If you look at those percentages down there, that really describes the largest group of us, that we will see resilience in these times of very difficult stress. The second group I want to draw your attention to is that dashed line that has recovery right above it. These are people who, after a traumatic event, have moderate symptoms. So they're having trouble, for several weeks. They're not eating well, they're not sleeping well, they're crying a lot, they're irritable all the time. But after a period of time, and as you can see, after a year, they're starting to do better. This is without any intervention. This is just normal recovery after a traumatic event. So they're starting to come down, their symptoms are decreasing, and then after about 2 years, they're in pretty good shape. It's the other 2 groups that we worry about, which again, depending on the particular stressor, may affect between 0 and 30% of the population. But these are the people that are not recovering well. So unlike most of us who will be in the resilience or recovery groups, the people who are in the chronic stress group, chronic disruptions in their normal functioning, and the delayed response in their normal functioning with more severe disruption, those are the people that we worry about, that we talk to about getting into treatment. And this is particularly important just for future reference, is that as psychologists, because we know many people are going to recover without any intervention, we try not to intervene during the first month after an event, such as after a mass shooting or even after a hurricane or other things. We wait to see who is going to recover without any treatment, because we don't want to provide treatment to people who might not need it. We could end up making them worse. So we watch and we monitor and we look for these different patterns of recovery. The event that changed the trajectory of my career, in the sense that I was doing a lot of work with all kinds of anxiety disorders. But I was in Pennsylvania the day that that shooter walked into the community of Nickel Mines and sent all those boys home and shot all those girls in the back of the head. 5 of those girls came to the hospital where I was working in Hershey, Pennsylvania at the time. And as horrific as that event was, what struck me also was the amount of resilience, and the resilience of that particular group, in the sense that, you know, the oldest girl in that schoolhouse stepped forward and said, "Shoot me first," to try and save some time for the younger kids. The women that night took food to the widow of the shooter, because after he shot all the girls, he shot himself. They took food to his widow and to his children. And that weekend, more than 50% of the people who attended the shooter's funeral were the people of the Amish community of Nickel Mines. 5 girls died as a result of that. 5 girls were injured. But when someone asked them how they could do that, they said, "With God's help." Now, for them, it was the God of their religion. For other people, it's a sense of spirituality. But it's this idea of connectedness, this idea of somehow getting through things together, that has been shown to really allow people to get through the most horrific events. It's something that in the psychological literature we call tend and befriend. Tending, after a traumatic event, tending is looking around for those who are most vulnerable, the youngest, the oldest, and making sure they're taken care of. And then befriending, making friends with others who have experienced the same event, strangers who become lifelong friends as a result of having gone through a traumatic event together. What we use a lot in both the military and in the first responder literature are the areas of what we call peer support. So in many cases, we know that active duty personnel, first responders, don't want to go see a psychologist or a psychiatrist because they think it's the end of their career. So what they will do is they will try to reach out and talk to someone else who has experienced the same event, another firefighter, another police officer, a veteran. In the peer support literature, we actually do training in how to make firefighters effective peer supporters for the rest of their department. Or same thing, we've trained Florida Highway Patrol, we've trained many different police organizations, many different departments. But this idea that there's an intermediate step between I'm feeling awful and man, you need to go see a shrink. The intermediate step is talking to a peer, getting some perspective, finding out what's going on, and perhaps being that bridge to getting the people who need it most the right level of care. Peer support training not only, again, can decrease people's emotional distress, but it can improve their functioning at work and in their lives. It's also been shown to decrease the rate of suicide among first responders. So again, thinking about peers supporting each other is an important part of resiliency. And then finally is this whole idea of post-traumatic growth. I put the Parkland kids on here because in talking to them, I told them that, you know, we wouldn't let them down. We as adults wouldn't let them down. But the Parkland kids are just one example of people who take an event and try to make meaning out of it, an effort to make meaning or to make change out of some kind of tragedy. And it can be something like setting up a memorial. We often see this after an event. People will fund an organization or do something to memorialize someone who's been lost. New organizations, political actions may start out of this, but it doesn't always have to be something political. It's a way that people use after a traumatic event to make meaning and to grow from a horrific event. And it's a particularly important point because so many people, what we're trying to do is change the stigma. So many people think if you have post-traumatic stress disorder, you're broken and you're broken forever. That's not really the case. People can grow from this. People can get better. It doesn't mean that the event has gone away or that they'll never remember the event again. I tell people, if a therapist tells you they're going to erase your traumatic memory, run like the wind in the opposite direction. It's not going to happen. People don't forget the traumatic events that happened to them. What they do is they learn the skills and they learn the behaviors that help them go back to some typical functioning. Sometimes they're stronger as a result of it. Sometimes they're back to normal. But the idea is that you can get over this event. It doesn't have to, rule your life from now on, that there are ways to grow from it, ways to put it in its place so it becomes a memory, something that happened to you and you put it in a filing cabinet. Think about it like when someone close to you passes away. At first, every time you think about them, you become emotional. After a while, you can smile about something funny you remember about that person. You've put that memory in its place. You haven't forgotten the person, but that person's passing no longer dictates your emotions, dictates your behaviors. And that's what we need to talk about when we're talking about post-traumatic growth. So it's sort of a tour through managing stress with some quick tips that one might use to help manage the acute things that are going on, some tips to manage what we're all facing during this global pandemic, and hopefully leaving you with a positive message that we're going to get through this. We're going to get through this. We're going to be stronger. We're going to have learned from it. We're going to have changed relationships, maybe a changed perspective on work and on family, but it's going to be okay. So with that, I think we're going to have a discussion and talk about some questions. So I'm going to give the screen back to my colleagues.
Thank you, Dr. Beidel. And at this time, we'll take some questions from our audience. First being, stress seems inevitable and or useful. At what point does stress transition from a motivating force to a destructive one?
That's a really good question. And I think we can really think about that in a couple of ways. If we think about just anxiety in general, think about, what we call sort of an inverted U. What we know is that a moderate amount of stress, a moderate amount of anxiety really does help us do our job better, right? So if we're not nervous at all about taking a test or, some upcoming event, we may not really function at our best, right? We got to get, as we call, psyched up. And we know that a moderate level of stress will sometimes help us function best. When does it become a destructive one? When we psych ourselves out, when we become so stressed that we can no longer function anymore. And again, we're talking about a change in behavior here. That's what we use to examine this. So it's not just how stressed out am I, how psyched out am I? It's, am I overly stressed, or have I psyched myself out to the point where now I can't function anymore? And that's when it becomes a destructive one. And for all of us, that may be different. Some people may find that, they thrive in a more stressful atmosphere, but they too have their point where it's going to become destructive. And again, thinking long-term in terms of that general adaptation syndrome that I showed you earlier, it's moving from that second phase where we're coping, we've got some strategies that seem to be working, to that third phase where we're just exhausted, physically exhausted, mentally exhausted, emotionally exhausted. We can't work anymore. We're not doing our jobs effectively. We're not being the parent or the spouse or the friend that we used to be because of our exhaustion. That's when it becomes destructive. So focus on behavior.
And with that focus on behavior, that actually leads us to our next question. What are signs of an overstressed employee in the workplace that supervisors can look for, and how can they help?
Again, I think, you know, if you're talking about people who are back in the workplace, look at who's coming in late. Look at who's calling off. Particularly if they're, you know, sometimes in the alcohol literature, we've looked at Fridays and Monday call-offs as a signal that someone may be really using too much alcohol. They've gone on a bender over the weekend and Monday morning they can't function. But even taking alcohol out of the situation, people who never took off sick, who are now calling off sick, and maybe calling off sick on a Friday or a Monday or on the day of an important event, right? So there's supposed to be a big event, and you know, someone who's supposed to be there has a critical role there, calls up and they're sick, they can't come in. Those are some of the signs. So absenteeism, increased absenteeism, let me say that. The other is to look for people who really, you know, are no longer doing their job, or they've become so irritable that there's talk about them in the workplace. They're flying off the handle all the time now. You know, they're getting into shouting matches with people that they never got into shouting matches with them before. Those are signs that someone is overly stressed. And the third I would look for would be changes in people's social behavior. So as I said, people who were always, you know, in the hallway, who wants to go to lunch, or come on, let's go get some coffee. Now they're suddenly just sitting at their desk all the time. They're not interacting. Maybe they're keeping their door closed. You know, the place where I work in the clinic, unless we have a patient, you know, we typically keep our doors open and people know they can stick their head in to ask a question. So someone who typically had their doors open now suddenly has their door closed all the time. I think the way to help is, I would say, to have general conversation with everyone about stressors. Maybe some of the things that, you know, you learned here today, or some of the slides that you have that we'll supply might be useful in having people sort of learn that you as the employer understand that they're stressed, that everybody is stressed, that you yourself are stressed. And I often tell, you know, people this when I'm talking about don't use alcohol to sleep. I say that's the mistake I make on every red-eye flight, or every flight when we used to be able to fly to Europe, was I'd think, oh, if I just drink enough wine, I'll fall asleep. Well, it doesn't work. Doesn't stop me from doing it the next time. But the idea is, if we normalize stress, if we look at stress as not something that is bad, but as something that we're all in this together. You know, it's been a year now that we've been, you know, had a big change, and we're working from home. Some people have gone back, some people haven't. But the fact is, this is a global pandemic that's been going on for a year. I worry about the people who aren't stressed at some point by this. Those are the ones that I really worry about what's going on there, because I often get asked why I don't help people so that they don't have post-traumatic stress disorder. Why don't I do something, you know, condition soldiers so that they never get PTSD? And the answer to that is, then that's not a human being with a heart, that's a machine. And I'm not going to help make machines, because machines aren't going to run into a building that's on fire to save someone, because they don't have that desire within them, that human heart that they will sacrifice themselves. So I think if we normalize this, if you go to our website, ucfrestores.com, we've got a tab on there that says resources, and there's a series of videos where we talk about relaxation and deep breathing, where we talk about sleep hygiene, as we call it, where we talk about anger management. You know, you could say to your employees, hey, I attended this webinar and the speaker talked about these really good videos that you can look at to learn about these different things. But I would talk about it with everyone, so as not to seem to be singling out. And then if you have someone who is problematic, then you need to be able to pull them aside and talk to them about how maybe they need a vacation, maybe they need to hear about EAP again. But to look at it in terms of behavior and helping them get back to being the best employee.
And as you know, this pandemic has thrown some unique situations our way, and an audience member has asked, how can we analyze work from home job stress due to office facilities not being available or accessible?
Mm-hmm. I think that's a difficult one. But again, I think there are some things that you can do. Again, I think, first of all, asking everyone if they have everything that they need to be able, it's a little late now, but do you have everything you need to be able to do your job from home? And making those changes where you can. In the case of our situation, we had to give people laptops, so there would be a second computer at the home, so that the kids could do their work at school, do the homeschooling, and the employee could still have access to being able to work on the internet and do their job from home. So I think it's, it's simple things such as, have people talk to you about not even having a place at home where they can work, and how can you help them problem solve that? Do they have the equipment that they need? Do they have the time that they need? I mean, some people are just going to have real difficulty because of the situation that they're in. And I think that the only way to do that is to maybe adjust some of the job expectations. For example, one of my employees came to me, a young woman in her 20s, and she had a little brother who was 12. And she came to me when this started and said, my parents don't know anything about the internet. I have to help my little brother with his schoolwork. And so we worked her schedule because we could, that she was able to do more of her work in the evening, and be able then to be available for her brother during the day to help him with his schoolwork and to keep him on task at school. So again, I think being flexible in doing these things, but again, looking at asking the questions, about what do you need to do your job? How is it going? You've got 3 kids. Are they back in school? How are you coping with this? I read this article where lots of parents are having this kind of stress. So I think, just being upfront and honest about this and not having the exact same expectations that we did in 2019, because the world has changed. And we all have a lot more stressors. And so I think understanding that and also vocalizing that so people feel free to be able to talk about what it is they might need in their situation. That would be my best response to that.
Our next question.
Yes.
Please discuss the reports of increases in suicides and suicide attempts during the pandemic.
They're true. I think that what we see in increases in completed suicides and suicide attempts is a result of the very desperate conditions that some people find themselves in. So if you've lost your job and now you're going to lose your housing because you can't pay the rent or the mortgage, you're food insecure, and so you're not eating. This leads people to feeling that there's no way out of a particular situation. And what happens when people become this distressed is they feel that suicide is the only way out. The key to people actually completing suicide is a feeling of hopelessness. It's not just feeling very, 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 very sad or depressed. It's that they feel hopeless. There's no way out. If people feel that if I can get through this month, things are going to be okay, those are not the people that will complete suicide. They'll hang in there. It's the people who feel there is no way out. And I'll tell you, One of the things that we find that is best for keeping people from completing suicide is social contact. One of my former trainees is a psychiatrist who worked in Milan, and she worked in the worst part of that city when that whole city was locked down. They lost an entire generation in the early days of COVID. All of the grandparents in that one city passed away from COVID. And she was stuck in the hospital doing work she hadn't done since she was a medical resident. And I said to her, "What can I do for you?" She said, please send me a little note every day. I don't care if it's a picture, a piece of song, or just a hello, I'm thinking about you right now. She said, please send me something so that I know that people are out there and we're not alone as we feel. This idea of social connectedness is the critical factor that we know right now that keeps people from deciding to complete suicide. We all can do this. You don't have to say, hey, are you feeling hopeless today? Just reach out to people you may not have talked to in a while. Say, hey, I was thinking about you today, or, you know, this song made me think of you. How are you doing? You know, here's a stupid picture of my dog. But this idea of social connectedness and of reaching out to someone, I tell our first responders, you may think you're just sending them a line, but you could really be throwing them a lifeline. You could really be the person that day that keeps them from deciding that there is no hope, because your connection with them can keep them from deciding to complete suicide. So these reports are very real. We can do something about it. Thank goodness we have the internet. It would be a whole lot harder if we weren't able to connect in these ways, but we all can play a role in this, and you'll never know. You probably will never know what you did in that particular moment. So reach out to people. You don't have to do it every day. Just connect with people. Think about people you haven't talked to in a while and connect with them just to keep that social connectedness there.
In addition to suicide attempts, have you seen an increase in substance abuse or use of prescription drugs during this pandemic?
Yes, we have. It's mostly been substance use. It's primarily been increases in alcohol use. I don't know if that's the particular way that the data are being surveyed, but we've certainly seen that. And we've certainly seen that because of things that, you know, we associate with alcohol or with taking drugs. You know, we associate the fact that alcohol helps us relax. Well, very temporarily it helps us relax. Alcohol is really a depressant. So it ends up maybe relaxing us for, you know, 20, 30 minutes, but then we start to get depressed if we keep drinking alcohol. But people have that idea that, you know, and how many times have each of us said to ourselves, oh my God, I need a drink. The other thing, as I said, is there are lots of people who think I will have some alcohol before I go to sleep because then that way I will go to sleep. So they have used alcohol in that way. And so we just, and, you know, I mean, even during the worst part, places would deliver alcohol, right? You could buy wine over the internet. So that was a way for people, you know, to think they were coping effectively, when in some cases they certainly were not coping effectively. They were actually doing more harm. But we have seen that, and I don't know what's going to happen because I don't know what our new normal is going to be yet, but we have seen this increase in all of these negative and destructive behaviors because it's common. That's what we do. You know, we first turn to what it is we think we know, what we've heard about, to try and make ourselves feel better. So all of those things have increased, definitely, as has domestic abuse and child abuse. You know, people are locked in their houses and they can't get away from an abuser.
Lastly, Dr. Vital, are there any websites that you can refer our audience to?
Sure. I think there's lots of websites. I'm not promoting just mine, but we have specifically put up this series of videos that we did. We had CARES money, and we used the CARES money to develop these videos for information, and particularly for the public, on little skills for relaxation, for sleep hygiene, all of those things. There are probably other places as well. I really do recommend the Calm app. There are many apps out there. There's a lot of apps out there that aren't tested, but the Calm app is really a good app in the sense of having people learn how to take some deep breaths, other ways to try and sleep. So those are the two that I know. You can Google, there's probably some more that are available, but I think getting the information out to people is what's really important. So I would start with those two, and I'll try and find some others, and I can send them to you, Nick, so you can send them out to people later, maybe.
Sure. Well, thank you, Dr. Beidel and Dr. Warwick. A special thank you to our attendees for your participation in today's webinar on managing stress and coping during COVID-19. If you have not yet completed the survey, please take a moment to do so now. The survey can be found in the questions panel. I'll leave the presenter's contact information up for a little while so you can jot that down should you have any additional questions that weren't addressed. And this concludes today's presentation. Thank you all for joining.